Hi, everyone. It's good to see you. It's me, Elisa DeFalco, OT and massage therapist, and most of all, MLD therapist for 23 years. And guys, we have a really good question today that I think that would really be a topic for all of us, even though we touch on it in class. And that has to do with blood clots. So let me have you hear this question in dialogue between me and another therapist. She says, "Thank you for your response. I remember all the blood clot information from class, which is why I reached out. I will look for the posted video as well." So we do have video postings too, small ones. The patient's oncologist had released her for manual lymph drainage a few weeks after her clot episode. So she just had the blood clot and the doctor released her to have MLD. So she says, I had to question it. She had the May-Thurners syndrome rectified via surgery a few years prior. Of course, I have insisted on written doctor release before performing MLD on any of my cancer friends. Most have had major issues. This is why I feel they all could benefit from MLD. I personally am having amazing results, and she is, but she's doing the right thing by seeing the doctor first and getting it in writing, especially if they've had a previous blood clot. If they just had a small blood clot and it kind of came and it passed, I'm not too worried, but I still get that in writing. If they have a long history of blood clots, then you have another concern on your mind. If they have many blood clots, I would not want to be doing MLD, even if they told me to do it. Just because we know from MLD and from the writings from Germany that that's not good. So she says, the good thing is my face is clearer and a healthier pink. Clothes are looser and I'm down 6 pounds of stagnant lymph. Clients are taking notice. To further educate, I have ordered a few MLD books, including the compendium, the one we've been talking about. I'm currently reading, and it's called, just if you don't remember, the Compendium of Dr. Votter's Manual Lymph Drainage, written by Renato Casaroller, okay? And then she goes on and she talks about a second client she has with similar issues. So she says, I wasn't sure if I caught the video about the blood clots that we put up, but here's the skinny. Blood clots are contraindicated until the physician feels they are satisfactorily resolved before performing MLD, which she is right. With an ongoing condition like this, however, it might be contraindicated altogether. So she's right again, right? What we said. If you have it and it's minor and the doctor says it's okay, that's one thing. If it's something that's more aggressive and more progressive, then it'd be a situation where the doctor should make the call, but you know what, you're the therapist and you're certified, And if I didn't feel comfortable, I just wouldn't do something I felt not comfortable with. I've had to do that a few times. So thank you for your question, and we hope you are having a great new year. And then she puts in one final one. I have a client that has May Thurners syndrome. She wants MLD. The condition makes her prone to DVTs. She has a swollen limb, left leg. I've reached out to her, asked her doctor's note or for a note. In the intervention, I've asked her if she has ever had a blood clot. If so, when? Please advise, and please, she's asking me to give her some advice. And I'd like to take a swollen knee over the diagnosis any day. I totally get it. A swollen knee is a swollen knee, but dealing with blood clots is another issue entirely. And it comes down to how many did they have? How bad were they? How often did they have them? And does the doctor say it's okay? Those are the 4 things I'm looking for. If there's any one of those items there that are missing, then I'd be concerned. So my guys, my girls, my friends out there, I hope this has helped you when dealing with blood clots and unusual autoimmune conditions like this one. So hopefully it helps you make the right decision. You know my phone number at the MLD Institute, 954-709-0042, or lymphdoctors@gmail.com. And hopefully that will help you to make the right decision when dealing with your clients and patients. Thank you so much for giving us your information and sharing with all of us. And I look forward to seeing you again soon.